Hello, everyone, and welcome back to Daily Dollars. Today, we're tackling a huge story that could shake up healthcare for millions of Americans. We're talking about potential Medicaid cuts under a brand new government initiative called the Department of Government Efficiency, or DOGE. Now, there's been a lot of speculation about what this means, who's involved, and what kind of changes could be coming. We're going to break it all down from what's the fact, what are the predictions, and most importantly, how it could affect your healthcare and finances. So grab a coffee, hit that like button, and subscribe to Daily Dollars for more informative updates. Let's get into it. First, let's talk about the Department of Government Efficiency, or DOGE, is a newly proposed initiative under the Trump administration aimed at cutting $1 trillion from federal spending. One of the more surprising things about DOGE is that it is expected to be led by Elon Musk due to his background in business and efficiency-focused leadership. The goal of this initiative is to reduce government spending in a big way. And that raises a critical question: where will these cuts come from? To understand why Medicaid might be a target, let's take a look at how the federal government spends its money. In 2024, total federal spending was around $6.75 trillion. Out of that, about $4.1 trillion, roughly two-thirds, went toward mandatory programs like Social Security, Medicare, and Medicaid. According to reports, President Trump has promised that Social Security and Medicare will not be touched by these spending cuts. That means Medicaid, which cost the government $611 billion in 2024, could be a primary focus for reductions. And here's where things get complicated, because cutting Medicaid isn't as simple as reducing a line item in the budget. It affects real people, state governments, hospitals, and the entire healthcare system. So what changes are being considered? According to TD Bank's economic forecast, there are a few key possibilities. First, switching to block grants or per capita spending caps. Right now, Medicaid is funded through a federal-state partnership, where the federal government covers a percentage of each state's Medicaid costs. But one proposal on the table is to switch to block grants or per capita spending caps. This means states would receive a fixed amount of funding instead of a percentage of their actual costs. Supporters argue this could save the federal government nearly $900 billion over the next decade, according to a 2022 Congressional Budget Office report. But the downside? States would have to make up the difference. That could mean raising taxes, cutting benefits, or tightening eligibility requirements, potentially leaving millions of people without coverage. Second, stricter work requirements and verification measures. Another possibility is tightening work requirements for Medicaid recipients. This would mean that to qualify, individuals would need to prove they are actively working, looking for work, or enrolled in job training programs. While this might sound reasonable on the surface, past attempts at similar policies have led to unintended consequences. Studies have shown that many Medicaid recipients already work, while others such as caregivers, people with disabilities, and those facing health challenges could struggle to meet the requirements. If people lose coverage because of bureaucratic hurdles, hospitals could face a surge in unpaid medical bills, driving up costs for everyone. Medicaid isn't the only program that could be affected. The Affordable Care Act could also see some major changes under DOGE. One of the biggest concerns? Enhanced premium tax credits. These tax credits have made health insurance more affordable for middle-income families, but they're set to expire at the end of 2025. If they aren't renewed, the cost of health insurance could skyrocket. Right now, the average person benefiting from these subsidies pays about $360 per year in premiums. If the subsidies disappear, that cost could jump to $1,860 per year, a massive increase that could push many families out of the insurance market. And that's not all. DOGE may also consider rolling back Medicaid expansion, which was introduced under the Affordable Care Act. This program allows individuals earning up to 138% of the federal poverty line to qualify for Medicaid, with the federal government covering up to 90% of the costs. If this funding is cut, some states may have to reduce coverage or reconsider their participation in the program. So what does all of this mean for the average American? Well, right now, nothing is set in stone. Any major changes to Medicaid or the Affordable Care Act would require congressional approval, and that's a long and complicated process. But here's what we do know: if these cuts move forward, they could reshape healthcare access for millions of Americans. Hospitals, state governments, and families could all feel the impact. And while reducing federal spending is an important goal, the real question is, at what cost? So, what do you think? Should Medicaid cuts be on the table, or should the government find savings elsewhere? And how do you think these potential changes could impact everyday Americans? Let's start a conversation in the comments below. If you found this breakdown helpful, make sure to hit that like button, subscribe to Daily Dollars, and turn on notifications so you never miss an update. Thanks for watching, and I'll see you in the next one.